Thank you. Senator Marshall.
All right, thank you, Chairman. This is obviously an issue very near and dear to my heart. It's an issue that I've dedicated my life to solving. And before I go on with my remarks, I want to make sure everybody knows that one maternal death is too many. And yes, we need more minority doctors, nurses, the whole gamut, okay? I totally acknowledge that. Mr. Chairman, I would suggest that the work we've done with community health centers will do more to impact this than all the other ideas we're hearing about. That our vision of these community health centers would have prenatal clinics in them and then help take care of the woman after the baby's delivered, something as an obstetrician that maybe I didn't do the best job after we got to about 6 weeks. And the other thing that would impact this more is stopping the illegal crossings on our border and the fentanyl poisoning that's just not, it's accumulating problems for my moms as well. You know, my story, I think it's, you have to hear my story, and I'm sorry, but I'm a first-generation college student too. I went to a community college. My wife went to a community college nurse. 90% of the nurses in our hospital are community college nurses. Went to a residency program in St. Pete, Tampa. Very busy, 8 residents, 5,000 deliveries a year. So in 20,000 moms that we delivered, you know how many maternal deaths we had? It's 0. And how? So the answer is how come? 2 things. One, we had incredible committed doctors and nurses and ultrasound techs. But number 2 is I set up a prenatal clinic. When I got there, a fourth, maybe half of our moms were not getting any prenatal care. I went to a church on the wrong side of town and said, can we use your basement to set up a prenatal clinic? And made sure that every mom had prenatal care before they ever got to the hospital. And that probably, you know, how many lives that saved. But that was one simple solution. And then in my private practice, half of my moms, I delivered over 5,000 babies personally, and half of my moms drove more than 60 miles to see me. By the way, the only thing worse than no prenatal care is bad prenatal care. It scares me to death when people think that they should be delivering babies in facilities that have 1 delivery a week or 1 a month. That's a scary situation as well. But again, 0 deaths. Why? Because, and half the babies we delivered in residency were minority. Half the babies we delivered in my private practice were minorities, half of which were on Medicaid or had no money. So it wasn't like it was this perfect group of people that had everything in life. Half of my patients spoke Spanish that I delivered. So, you know, those were challenges, but no deaths. It's because we gave prenatal care, and I was obsessed with prenatal care, and my nurses were obsessed with giving good prenatal care. Ask the panel, how many women died in 2023? Maternal deaths were there in 2023? Does anybody know the answer to that? Okay, it was 684. In 2021, it was 1,205. So we dropped from 1,200 to 684. So first of all, I want to thank all the hardworking nurses and doctors and the people out there at community health centers that are making a difference. Next, what's the most common cause of maternal death now? Does the panel know that? Go ahead.
In Black women, cardiovascular disease. In Native American women and in Caucasian women, we sometimes see mental health and substance use disorders.
Yeah, I wish that was the case, but the most common cause of maternal death now is suicide and drug overdosing and fentanyl poisoning, okay? That's the number 1 cause. And what percentage of these deaths occur more than a week after delivery?
Over half, around 52%.
Yeah, 52, 53%. So half of these deaths are occurring after, a week after delivery. That's why these community health centers are so important, is to follow up on the mental health aspect, let alone the addiction issues as well, okay? So that's the solution to the postpartum issues. Intrapartum, number 1 causes now hemorrhage, heart disease, stroke, PE, cardiomyopathy, infection, hypertension. Those are the ones that we can impact with prenatal care and intrapartum care as well. And I think we have to also acknowledge why is heart disease spiking right now from a maternal M&M situation as well? Well, it's several reasons. One is our moms are older. Number two is they're heavier. And number three is diabetes. The amount of diabetics, type 2 diabetics that I saw in my clinic doubled or tripled in my 25-year career. So again, we go back to our community health centers with nutrition as a component, with mental health as a component, that we hopefully have healthier moms before they get pregnant. That's what's going to impact all these. We don't need to form committees and pray about it. We know the solutions. I think our community health center is the best thing I see out there that's going to touch all people, and just look forward to continuing the great work the chairman and ranking member have done in these issues. So thank you so much. I yield back.
Let me just inject what Senator Marshall was talking about. Get that legislation moving again.